My name is Nubia Ramirez. I used to be a social work intern at UC Davis Mind Institute, and I am a long-term trainee. Today, I will be talking to you about a policy proposal that I wrote as my leadership project that I named Caregiver Educational Autism Program. So this is a disclaimer. Although the LEND program is supported by the Maternal and Health Bureau, everything that I present to you today comes as my own ideas. I also want to briefly give a disclaimer that I recognize and respect the differences in preferred language in autism. And today I will be using the language that is preferred by many families of young children with autism diagnosis. So the inspiration for this project comes from my capstone project that I did for graduate school, which focused in autism among white and non-white children in the US. And my main interest in engaging in this project was, now that I started and completed grad school, I understand of the importance of large-scale work, working with communities, working on policies that I know impact large bodies of people. Also an interest in gaining or beginning to gain experience in policy development and feel that what I'm doing is actually making an impact on our communities. And also I wanted to challenge myself to come out of my comfort zone and learn about a topic that I've always found to be so complex and intimidating. So I thought it was a great opportunity for me to develop some leadership, engaging in something that makes me uncomfortable and try to improve my skills in it. So a little bit of background on my policy proposal that I wrote. We have the statistic from the Centers for Disease Control and Prevention that 1 in 44 children in the US across all racial and socioeconomic backgrounds are identified with autism. And diagnosing autism at an early age has a direct impact on the child development and overall quality of life when we think about connecting said children to resources and services that are going to help them progress in their life. These early intervention strategies promote developmental improvements. They enhance lifelong prognosis. They diminish the need for later treatment and save monetary resources for the families and also for the systems that serve them. So a little bit around the issue with diagnosing autism, especially in small young children. Early interventions, as I mentioned, have substantial potential for long-term impact, especially if they are implemented in children as young as 2 or 3 years old, when their brain is still malleable and you can still work very well with it. Although this is true, the autism diagnoses are often delayed until children go into school and they are connected to the school system. Another part of the issue that I was trying to connect by writing this policy proposal was that only about 39% of early intervention agencies perform diagnostic evaluations before the age of 3 years old, although autism can be diagnosed as early as 18 months or even younger, and is reliable by age 2 if it is performed by a provider that has experience. From all of the pediatricians that have been certified as of 2017, only less than 1% have been certified in the subspecialty of developmental behavioral pediatrics. So some of the ongoing efforts to address the issue of early recognition and identification of autism. So the CDC has a program, Learn the Signs, Act Early. You can find the information through their online platform. It has tools for tracking growth milestones. It has plenty of free printable materials, training resources. It has some recommended actions if there are any concerns, and it has information about other programs. And although this is a great program that is run, accessibility and effectiveness are limited by a user's literacy skills and internet access, also by knowing that there is such a program that people could look into if there are any concerns. Another effort is the American Academy of Pediatrics Autism Screening Guidelines, which suggest all pediatricians and providers for small children to conduct autism screenings at 18 months and at 24 months old. And although this is also a great initiative, there's a big limitation, which is that the guidelines are not incorporated into a mandate, making it optional for the pediatrician or also dependent on their time and availability to use such screenings for the clients or the patients that they see. So what I'm proposing with this policy is to develop and implement a community training program about early recognition of autism. This program would be directed to frontline caregivers, which means this could be daycare staff, preschool workers, parents, grandparents, and this would all be caregivers of children from birth to 3 years old, which is before going into school. And the target audience also represents individuals who are in direct contact with the children in this age, which know them best. Some of the ways in which this program and this policy address disparities is by providing practical education and training on autism free of charge. It focuses on a group that is not yet connected to a school system. Like the background was mentioning, many of the diagnoses happen until the children go into school age. The program focuses on children who are still not connected to the school system. It also addresses access barriers by having trainers present and explain information in a digestible way, and also having somebody directly talking to you about things gives the opportunity of having questions answered in the moment. Also supports, of course, COVID permitting, increased social connectedness by having in-person interactions. Besides being free of charge, it would also be delivered in settings that are in the community and that are familiar to the caregivers that would be attending. Just a little bit about the program development. You would have interactive modules that would be imparted by trained healthcare professionals and any other community members who are interested in child development and in autism itself. The curriculum would have distribution of and education about the use of tools and next steps. So the use of tools, for example, the CDC documents that can be found on the platforms, and next steps could be how to talk to your pediatrician, how to request an evaluation, and learning more about just healthcare systems as a whole, because I think we as a community in general do not have that much knowledge about how medical system and the insurance system works, since it's very, very complex. So the location would be daycares, schools, clinics, week centers, Help Me Grow Sacramento, First Five programs, any other religious or spiritual organizations, or other organizations that are willing and accepting of the program. The program would offer incentives to motivate participation, and this would be incentives to the trainers themselves for their time, and to the attendees as an incentive for participation and completion of the program. And the promotion would be through routine pediatric appointments, flyers that are going to be spread through the community, and also using social media platforms. And the program itself would be funded by grants, which would increase its acceptability, which would have a funding of its own instead of taking funds that are already existing in the community. And just quickly as a conclusion, and maybe this is extra, right, that we understand how important it is to make our community more knowledgeable about autism signs, how to recognize autism in early ages, and to intervene to give our little ones a better chance for prognosis.
Len has his hand raised. Go ahead, Len.
Yeah, just that was a great presentation. Thank you very much. And I really appreciate kind of your kind of wide scale approach to that. I guess one question is whether you think that we'd also have to do training around stigma associated with the diagnosis in particular groups, so it's not just a matter of knowledge, but also kind of reducing the stigma and barriers to implementing.
Yes, thank you. That's a great question. Actually, I'm going to try this. I'm going to try to make this very brief. I feel very passionate about stigma, and also, coming from the Latinx community myself, I know that in my community itself, there's a lot of a stigma around neurodevelopmental disabilities and such. I do think it would be very relevant to incorporate stigma. Also, something that I thought about was if this program were to be implemented in our community, people being more involved and being more knowledgeable about neurodiversity and hearing more about it, and just making it more of a common topic to discuss. I think over time, if this program were to be implemented in the community continuously, the program itself would decrease stigma just because of how people would start understanding more about it. But yeah, there's definitely something that could be incorporated into the modules so that stigma hopefully decreases over time, which is definitely an important point to touch on.
Well, thank you so much. I really appreciate it.
Thank you.
I wonder, Nubia, if you're going to be putting this into like a policy brief or anything for sharing with our policymakers.
I would love to, of course I have worked hard for this. I do think I would have to, like make it, maybe I would have to maybe change a few things to make it like more like very direct and, to the point, but I would love to have other people check on it, because I truly think that it would be a great program if it were implemented in our community. And also, just super quickly, I just want to say that I know that when it comes to early diagnosis of autism and everything that it's connected to autism, there's many other policy ideas that I had, but of course I couldn't just tackle everything at once, but more complementary policies that, that now have to do with how to help parents navigate the systems, how to have enough in, intervention services and such. So any other complementary policies would also benefit this policy itself.
The UC Davis Mind Institute was founded in 1998 with the promise to reduce and prevent the disabilities that can be associated with autism and other neurodevelopmental conditions. Every day, our clinicians and researchers make progress on that promise. Our groundbreaking research on autism, Fragile X syndrome, chromosome 22q11.2 deletion syndrome, ADHD, and other conditions associated with disability are helping affected individuals achieve their fullest potential. Please visit our website or our social media platforms to find out more about current studies, upcoming events, and how you can help make a difference.